Hello guys, my name is Celicia Gissendanner and I will be presenting to you guys today my question on should obesity be considered a disease? So obesity is a medical condition that occurs when a person carries excess body weight or body fat that can negatively affect their health. While some argue that obesity cannot be considered a disease due to its preventable risk factors, it is important to note that obesity has many complex causes, including genetics, environmental factors, and personal behaviors. In a certain addition, obesity is associated with a range of health problems such as diabetes, heart disease, and certain cancers, which are often classified as diseases. I completely understand the controversy surrounding the topic of weight and whether or not obesity should be considered a disease. Many people believe that being overweight is a choice and that it is a result for the overconsumption of too much food for comfort rather than for health and nutrition. On the other hand, some argue that the problem stems from our environment rather than our bodies. While it is true that certain individuals might be more prone to obesity due to their genes, others believe that treating obesity can still be achieved through eating less, exercising more, and making dietary modifications, which can greatly improve the overall well-being of those who suffer from obesity. It's concerning to see obesity rates on the rise among young adults and children in America. We must encourage healthy habits and strive for a healthier population overall. It is alarming to know that obesity is linked to several health risks in a shorter life expectancy. While some experts believe obesity should not be considered a disease, there has been an ongoing debate about its legitimacy for a long time. Despite the extensive research on obesity and its effects on the community, a good treatment option for this condition is still unclear. Therefore, there is ongoing debate in the medical community about whether obesity should be classified as a disease. Others believe that a shift in focus from prevention to management may be needed if obesity is considered a disease. The topic of treating obesity is still a matter of debate among healthcare professionals. Some advocate for medicine and surgery as more effective ways to deal with obesity, while others argue that lifestyle changes, diet, and exercise is a better option. Obesity is believed to be a choice of lifestyle leading to other chronic diseases. In November 2013, the United States Surgeon General reported an estimated 300,000 deaths per year might be attributed to obesity. Obesity was the third leading cause of death in 2009 after high blood pressure and smoking. It is important to take care of our health, and obesity is a condition that can have significant financial consequences. Studies have shown that obese individuals tend to use healthcare services more often and require more specialized care, surgeries, and expensive treatments compared to those who are not affected by obesity. It can result in higher healthcare costs and expenses. The Center for Disease Control and Prevention reports that obesity affects 42.8% of middle-aged adults, leading to an increase in disabilities and healthcare costs of $147 to $210 billion per year in the United States economy. Awareness about the risk of obesity and taking steps towards a healthier lifestyle. As of today, there have been many claims that shows genetics, lifestyle, and economic disparities attributed to obesity. According to Dr. Cicely White, childhood obesity is a serious epidemic. Obesity is indeed a complex condition that is often misunderstood. While some individuals may attribute their weight gain to overeating, many factors can attribute to obesity, such as genetics, your environment, and lifestyle choices. It is also important to communicate and get involved in the community to become more aware of the potential dangers of the overconsumption of foods and promote healthy habits to prevent the development of obesity. According to the World Health Organization, rates of overweight and obesity continues to grow in adults and children. From 1975 to 2016, the prevalence of overweight or obese children and adolescents ranged from 5 to 19, increased more than fourfold from 4% to 18% globally. As a result, an increasingly sedentary lifestyle, physical inactivity is increasingly leading individuals to unhealthy lifestyles. As a result of a calorie deficit and excess consumption of calories, there is an imbalance in the physical activity. On the other hand, there have been many individuals who have been classified as overweight but are able to live a long, healthy lifestyle, calling themselves, quote unquote, healthy obese, with normal blood pressure, normal cholesterol, and no signs of other pre-existing conditions. These individuals sometimes have higher BMIs, but their overall health is in good condition, which doesn't fit the norm of what is considered to be a healthy weight in others. Many new drugs have come out that help with weight loss and calorie deficit. These medications have been shown to help with appetite suppression, increase feelings of fullness, and reduce cravings. Taking small steps in the fight to help the population lose weight has been a new step forward. Even though there have been many controversial arguments about drugs that help individuals lose weight or fad diets, as there are for the short-term goal, there have been many success stories from weight loss medication and diet and exercise modification. Taking small steps in the fight to help this population lose weight has been a new step forward. Health education is a great way for doctors to encourage their patients to take charge of their health and their care. To combat and fight back against this disease, what steps should people take? Obesity prevention and health education is such a crucial health and social issue. Educating the population on physical activity and better nutrition, high in proteins and less in fat, with a strong focus on prevention, coupled with improved healthcare services designed to support the obese population. These treatments and support have shown so many people ways of living better and healthier lives. The long-term goal is to get America more in shape and educated while maintaining a healthy lifestyle to obtain weight management. These small steps in the fight to help the obese population lose weight are great steps forward.